I'm Jana Hirschtick, and I'm an assistant research scientist at the University of Michigan. In terms of my research interests in tobacco regulatory science, I'm actually a social epidemiologist. So I'm interested in tobacco-related health inequities and how tobacco regulatory science can be used to reduce those inequities. For example, Black adults are more likely to smoke menthol cigarettes, which is currently the only cigarette flavor still allowed under FDA regulation. Also, Black and Latino adults are more likely to smoke non-premium cigars, which are heavily marketed in minority communities and offered at a lower price point than cigarettes. So those are just two examples of racial and ethnic health inequities that could be reduced by future FDA regulation. In terms of my academic journey and how I ended up in this field, I come from a background of community level epidemiology. I worked at a safety net hospital on the west side of Chicago for 8 years before joining the University of Michigan. And there I was able to see some of these inequities firsthand related to a number of health behaviors and outcomes, including tobacco use. We did a community level probability survey to look at health status in several communities throughout Chicago. And I remember in one predominantly Black community on the west side of Chicago, 50% of adults were current established smokers. And this was in 2015. So this is a rate that we've actually never seen at the national level and only came close in the 1950s. So really startling inequities related to current tobacco use. There is important work being done at the community level in terms of outreach and cessation services. But these are the types of inequities that could be addressed on a much larger scale with changes at the national level via FDA regulation. So I was interested in tobacco regulatory science because as a public health practitioner, I wanted to see firsthand how the regulatory process can be used to address these types of inequities at both the national and local level. I am not a simulation modeler myself, but I've been really fascinated to see how these models can be used to predict the outcomes of potential regulations, like eliminating menthol as a characterizing flavor of cigarettes. My advice for others entering the field of tobacco regulatory science is to be open to both a top-down and a bottom-up approach. Regulation is an incredibly powerful public health tool, and it can be used to make sweeping changes. And it's really important to pair that with the potential of a bottom-up approach and a thorough understanding of what's happening at the local level and how the regulations will play out in communities throughout the US. Thank you.